medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
There's something to be clearly said about light and our health. Now, too often we forget that without sunlight or any of the light that we actually need, the full spectrum, our immune system will falter. Our sleep-wake cycle would be blunted. Our mental capability would be compromised. And, of course, the lack thereof would also stop the natural production of vitamin D, let alone pretty much all the hormones, which we all know the amazing importance that vitamin D has with the human body. What you might not be aware of, but many have talked about, is our spiritual evolution, which, by the way, is also related to light, especially as light takes on the pineal gland, which is exquisitely sensitive to light. Now, with all our understanding, doesn't it make sense to incorporate some sort of light therapy into our armamentarium for patients? Not just telling them to go outside and get sunlight and fresh air, but to consider actual types of machinery that can imitate, if possible, the light that we require. There's something called PBM. It's an acronym for Photobiomodulation. Literally, it's based on using our near-infrared to initiate our chromophore activity. Those are cells that pick up light, stimulates cytochrome oxidase C, which in the end increases the number and function of our mitochondria. The net result, of course, is the production of ATP, adenosine triphosphate. Now, so many, if not pretty much, not all of our chronic diseases ultimately have mitochondrial loss and damage associated with them, and we have lots of vitamins and nutrients supposedly to help, but nothing can do what the sunlight particularly can. And 40% of the sun's radiation is near infrared. The biggest portion is near infrared. Now, correcting or getting near infrared to accentuate the mitochondrial, well, that change in the mitochondria depends upon the wavelength, the distance to our body, the amount of power, which is often expressed in joules. Too much as well as too little will have either little positive consequence, let alone maybe some negative outcome potential. It's called a biphasic response. A low dose of light is beneficial, but raising the dose may produce progressively less benefit until eventually there could be a damaging effect produced by very high light. A low dose of light is beneficial, but doing it slowly to getting the right amount is most important. Basically trying to emulate or do exactly what the sun should give you on the proper circumstances. The very first concept to understand is the development of a proper, what we call irradiance. Irradiance refers to the power density, which is measured in watts per meter squared or milliwatts per centimeter squared. And you should note the solar infrared averages an irradiance of around 20 milliwatts per centimeter squared during the day, with a peak irradiance reaching about 40 milliwatts per centimeter squared. And of course, that's what we want to try to make happen for us in whatever we're going to use. We're going to discuss some of the proper benefits in our part of this series. We're going to talk about some equipment that's pretty much imperative for us to do this type of repletion and get our bodies as healthy as possible. But it's important to recognize that the essential part of PBM, photobiomodulation, it plays in regenerative and revitalization medicine. More to come. This is part one of several parts. I'm Dr. Mitch Ghen. You can always contact me or have a question at drmitchghen.com. That's drmitchghen.com. Thanks for watching.